Hi everyone, Dr. Scott Schreiber here, continuing the conversation about lower back pain and potentially sciatic pain, leg pain. So one of the culprits would be a disc herniation. So I have a couple of models here, and we're just going to talk about this so you can kind of give an idea what exactly is a disc herniation. So and how to treat it and what we do. So this, if you look at the model, how this is looking straight down, this is what's called a nucleus pulposus. That's a jelly-like material, and then you have the annulus fibrosus around the outside. So the outer third of this disc has nerve innervation, which means it can potentially can sense pain. So if we do have pain coming from this, it generally would be on that from that outer third, potentially if it what's called an annular tear. There is some controversy with that, so you may go online and check that out. Some research says yes for sure. Other ones say no. There's no pain or whatever from that. So what happens with this disc herniation is that nucleus pulposus, the jelly-like substance, can start to kind of, as you can see in this model here, kind of push out into this annular or this annulus fibrosus. As it starts to push down, the annulus itself can actually do a bulge. So when it bulges, you have your spinal cord here and these other spinal nerves right through here. So that can cause irritation. When your body says, "Oh, well, what is this foreign object doing in this small space?" That's the irritation. It goes right after it. So we got these nerve roots that are right there too. So if we have this irritation again in this small space, it can go down your arm or down your leg depending on where the herniation is. So how do we fix that? That's the big point. We talked about spinal decompression. We've talked about potentially manipulation. We've talked about some exercises. When we talk about that extension or flexion dominant with the McKenzie exercises in particular, these herniations, with the whole idea is you're jamming this stuff back where it needs to go with repeated extension motions. So basically, if it looks like this, you're extending the spine this way, jamming everything forward to out of that space. Again, most patients that do have the disc herniations and that they are symptomatic do well with conservative care. However, there is a portion that we do have to send on for surgery and or injections. Research regarding injections and surgeries are mixed, but at this point, if they're not getting relief from conservative care, that's the next option. Interestingly enough, with the disc herniations, and they've done studies where patients have never had back pain before in their life, and they do an MRI, and some of them have disc bulges and herniations. So it doesn't necessarily mean that they're coming from a traumatic event, and if there's no pain, you have this disc herniation, these could definitely just be an incidental finding in some cases. So just to keep that in mind when you're like, oh, I have this disc herniation, but if they don't line up, it basically could just be, like I said, incidental finding. You could be born with it, whatever. So just to throw that out there, if you guys have any questions or concerns, feel free to reach out, and I'd love to answer them. Thanks. Bye.